Hi everybody. One question that I get a lot because I teach a lot of first aid and CPR classes is what do I carry in my first aid kit? And so I thought what I would do is take a few minutes this morning and I would show you what I keep in my first aid kit that I keep in my truck. Now a couple of things that you want to know about first aid kits. The first thing is don't have anything in your kit that you do not know how to use. And I have a couple of things in this kit that the average person probably is not going to know how to use, so I'll cover those as I go along. But don't have anything in your kit you can't use, and I've never been a big fan of having directions in a first aid kit because if you have to read the directions, again, you probably shouldn't have it in your kit. Let's see what we have in here. Remember, anytime that you are in a first aid situation, the biggest thing, three things that you need to worry about are airway, breathing, and circulation. So I have a couple of things in here that start with airway, including, you can see it kind of at the top of the video, including oral airways. That's something that the average person is probably not going to have in their kit. I have it because I'm trained in how to use them. Also, in this kit, you can see everything's pretty well organized and compartmentalized. When you talk about airway, I also keep nasal airways and some lubricant for those airways in my kit. If you don't know how to use them, don't keep them in your kit. I keep a CPR mask because now we're talking about airway and breathing. I keep a trauma shears, which you need for any kind of cutting. I have a stethoscope in my kit. Once again, I'm trained in how to use it. I use this for taking blood pressure, for checking breathing. I have a blood pressure cuff because taking someone's blood pressure can give me a lot of information when I do my initial assessment of that person. Since I do know some people that are diabetics and I'm trained in how to use it, I keep a blood sugar kit in my bag. You can never have too many pairs of gloves, so I keep extra gloves. Keep a tube of sugar that I can give to someone if they're having a diabetic reaction. Again, it's the idea behind carrying a blood sugar meter. I've got a splinter removal kit with a magnifying glass and a tweezers that has a real sharp tip on it. Place to take notes, write information down on your patients, pens. Keep a little pen light in here for checking people's pupils and their actions of their pupils. Now in the main part of the kit, again, I've got gloves. I carry a SAM splint, and that SAM splint is a soft splint that you can use to splint someone's arm or leg. It rolls up small and it will allow me to splint someone's arm or leg if they break something. I carry an Israeli trauma bandage or an emergency bandage for severe blood loss, dealing with severe blood loss. A couple of rolls of tape. Ace bandage, because you can always use an ace bandage for wrapping a sprained ankle or providing compression if you're putting a bandage on. I carry a number of triangular bandages. These are worth their weight in gold. You can sling somebody's arm, you can tie a bandage, you can do all kinds of different types of first aid with these. I carry 4 or 5 of them in my kit. I've got a rescue hammer here. This is what you would use for getting through a window. It's got a window punch. It also has a seatbelt cutter on it and a whistle and a nail to let the air out of tires. A couple of rolls of stretch gauze for making bandages. Lots of different sizes of absorbent pads, everything from 5x9s to 2x3s. I learned about these non-adherent pads. They're great if you're covering a burn because they won't stick to the burn or they won't stick to an injury if it starts to heal. So lots of pads. More roll gauze in different sizes. I carry a disposable respirator or a mask. I'm dealing with someone who might have something that's contagious. A pair of safety glasses because you don't ever want to get exposed to any types of bloodborne pathogen, and if you're in a particularly messy scene, a pair of safety glasses comes in very handy to protect yourself. Also, with regard to protecting yourself, a pair of leather gloves. If I'm at a car accident or there's sharp metal, I will put my protective gloves on underneath the leather gloves, and if these get bloody or they get dirty, I can just throw them away. But I don't have to worry about torn gloves then. As far as other small items, I'll carry moleskin. This is something you use for treating blisters. Hand sanitizer, keep everybody and everything clean. It also makes a butt kick and fire starter. An eye cup. This is what you would use if you're bandaging someone who's got an object or something that penetrated into their eye so that you don't disturb the object in the eye. Neosporin for infections. Cortisone for if someone gets into something itchy or gets a rash. Baby aspirin, 81 milligram baby aspirin for someone who's having chest pain. Again, don't give medications if you don't know what you're doing. Benadryl for any kind of an allergic reaction that someone's having. I have a pouch here with 6 sets of gloves in it. And out of everything that I use in my kit, this I probably use more frequently than anything else. It's a bag that has some antiseptic wipes, 3 or 4 different sizes of bandages, and it also has little packets of Neosporin. This gets used, like I said, more than anything else, so I keep it all in one place and make it very easy to find. Visine eye drops. Then in the side compartment, I have burn dressings and a couple of cold packs. These burn dressings are very handy to have. They're made by water gel. They'll cool a burn. They'll also keep foreign material out if you have an open burn. I have a little multi-tool with a small flashlight on it. On the other side, since this is the bag that I take with me when I go to the shooting range, this is actually a small trauma kit that has all the necessary items, including a chest seal, another pair of shears, very heavy gloves, roll gauze, and a clotting agent. This is something that would be used to potentially treat a gunshot wound. So that's it. That's what I keep in my first aid kit. Again, it's probably more extensive than most people, but I am a scoutmaster and responsible for a lot of boys. I do a lot of recreational shooting. I'm also an EMT, and so there are times when I'll respond to a scene and I need to have the things with me that I would want to be able to help somebody. So remember the ABCs, airway, breathing, circulation. Once that's taken care of, you can do a secondary assessment on a person. Anything in your kit should relate to one of those main items. If you don't know what it is and you can't use it, it doesn't belong in your kit. So that's what I have for today. Hope you enjoyed the video. Hope you learned something. Have a great day, and hey, take your kids camping.